In the midst of the COVID-19 pandemic, USCIS has done the right thing by agreeing to reduce in-person contact through rescheduling in-person interviews, naturalization oath ceremonies, and biometrics appointments. But we are still hopeful that they will do more. AILA has asked that USCIS, among other things, waive biometrics entirely for children and for those most susceptible to COVID-19, and also for those people whose prints have already been captured in the past. To allow more flexibility in the Form I-9 compliance process, to excuse any late filings for up to 90 days, and also to extend other filing deadlines like for requests for evidence responses and notices of intent to deny, and to allow employers to file I-129 petitions based on scanned or photocopied signatures rather than requiring original signatures, and also to be flexible regarding required initial evidence in support of petitions that are filed during this national emergency. Now, here's just one concrete example of how that kind of flexibility right now could help all of us. Just yesterday, Vice President Pence announced an HHS rule that would permit physicians who are licensed in one state to work in another state in order to help with the virus response. In keeping with the spirit of this rule, USCIS could exercise its discretion to allow international physicians who are here on H-1B visas and who are responding to the crisis to go where they are needed based on a filed petition, even if it lacks some of what would ordinarily be required initial evidence that could be time-consuming to obtain in the current environment, and then request that missing evidence later. This would get more trained and licensed doctors working to treat patients more quickly, something that we should all be able to support. Finally, please know that AILA staff and volunteers are working continually to keep members informed and up to date on the latest information and resources. AILA has created a one-stop COVID-19 Resource Center page on its website. This is where you can go to find everything we know about this crisis: practice pointers and alerts, sample motions, tools and tips for how to manage law practice in this difficult time, all presidential proclamations and congressional responses to the crisis, and copies of all correspondence that AILA has had with the agencies that govern immigration, asking them for accommodation in light of this national healthcare emergency. As a sideline witness to these efforts of AILA staff and volunteers over the past weeks, it is nothing short of inspiring and remarkable to see how the AILA community is pulling together. And I want to thank you all for your dedication to getting through this, to getting your clients, to getting each other through this. Together we can, and together we will. Stay safe out there.